Hi, my name is Casey Halpern, and I am Professor of Neurosurgery and Chief of Stereotactic and Functional Neurosurgery at the University of Pennsylvania. I also direct the Stereotactic and Functional Neurosurgery Fellowship Program, where fellows who are trained at residencies across this country come to seek further training in this incredible subdivision. Much of what we do as neurosurgeons in this unique specialty is deep brain stimulation surgery. This is the procedure that I focus on in my practice, using it for people with movement disorders, that is Parkinson's disease, essential tremor. We've made incredible innovations in the field of deep brain stimulation very recently that our patients are actively benefiting from. I'm excited to share these innovations with you. In addition to that, I'll share some perspectives as a neurosurgeon who has uniquely built a practice working very closely with the movement disorder experts here at Penn, but also working with neurologists both at Penn and in the community. We will give a general overview of deep brain stimulation, where we are, how it impacts patients. I'll share some evidence with you, share a little bit about patient satisfaction. There are different surgical targets that we use, and it's important to keep those in mind as you're programming the device and considering this therapy for your patients. There have been innumerable innovations in the field of deep brain stimulation. Very grateful to Boston Scientific for bringing us some of the latest and greatest of these innovations for our patients. And it really is allowing us to more efficiently take care of patients and really deliver the best possible outcome for their condition. So you can see here a schematic of the deep brain stimulation implant. I often refer to this as a pacemaker. In fact, some of the original deep brain stimulation devices were very much like pacemakers for their heart, but of course, instead of the wires being placed in the heart tissue, they're actually placed in the brain. Most surgeons, like myself, start in the brain carefully or stereotactically, meaning using image guidance, can deliver the electrode safely and precisely into certain parts of the brain, and those wires then get connected or locked in place at the skull. The area is then sealed, and then the wires are brought over to the side of the head, and then either at that time or at a later date connected to extension wires and tunneled under the skin down to the chest, and that's where the device is often placed. We've been doing this surgery for a long time for patients, and we've seen dramatic improvements in their quality of life. Thanks to some recent innovations by Boston Scientific, we're really able to actually deliver better care to these patients and get them better faster. One reason for that is that there's new electrodes that are available. These electrodes are extremely well made and rigorous. They are intended to be lifelong, and they also offer multiple areas along the tip of the wire that can deliver the therapy, meaning our patients and our programming neurologists have so many options to optimize the therapy. So here's some facts about deep brain stimulation you should know. This is FDA approved for patients with Parkinson's disease and essential tremor, reimbursed by Medicare and other insurance companies, private payers. Often there can be a deductible or a copay, but these are procedures that are standard of care for patients with Parkinson's and essential tremor. A huge advantage of deep brain stimulation is that it's non-destructive. This is not an ablative treatment that could be irreversible and lead to potential problems for patients. Rather, the stimulation can be delivered in a reversible and adaptable fashion. It's titrated to the patient's symptoms. I always tell patients who are often fearful of the idea that brain stimulation is getting delivered that if there is a problem, the device could be shut off. It's very rare for patients, obviously, to ask us to shut the device off. But certainly adjustments are necessary, especially because we expect these symptoms to worsen over time. And so the ability to adapt in time with the patient is really, really critical. These devices are conditionally approved for MRI, full body MRI. And so often patients with one of these conditions may need to get an MRI for an unrelated problem. You can see here, over 250,000 people have been implanted for deep brain stimulation therapy, largely for Parkinson's disease and essential tremor. The overwhelming majority would do it again and have had positive experiences. This is such an incredible piece of feedback. more than 98% of patients would say they would do deep brain stimulation again. I'm not aware of a treatment in clinical neurosciences, in neurosurgery, a procedure, of any kind that has that level of satisfaction.